So we are at, I think, a critical point in the pandemic. Clusters do exist in Dutchess County, but they are not the biggest driver of the cases within Dutchess County. What we are seeing is that once these clusters are identified, the containment and mitigation efforts are working, and the cases are limited to those particular facilities or areas. But the largest number of cases within Dutchess County are occurring in the casual setting, meaning in people's homes. What is happening is, and it's totally understandable, people are fatigued, they're tired. After 8-9 months of really being good at following the mitigation steps of distancing and wearing a mask, and hand and respiratory hygiene, people are to the point where, I've had it. But now is not the time. We are heading into the holiday seasons. And so the tendency is for people to congregate. And you may be asking yourself, oh, you know what, I know, my cousin, I know my friend, they could come over. But again, what happens is you don't know the steps they've taken to protect themselves and you know what you're doing, but oftentimes when you're not consistent, when other people are not consistent, these type of social gatherings, these type of settings can be the cause of community spread. In fact, that is what we're seeing in Dutchess. The cases are greatly represented by transmission that is happening in the community. One of the points that have to be made is earlier on in our planning, we were quite concerned that institutions of higher learning and the schools would be big drivers of cases in Dutchess County. And you know what? That is not what we're seeing. The cases that we're seeing in the schools are cases that are introduced by exposures that occurred in the community and then were introduced into the schools. Once they're identified in the school, what typically happens is a large number of people are exposed, and oftentimes staff are exposed, and then schools have to close. And so this has been a cyclical thing that's been going on. To their credit, the schools have been wonderful in terms of their response and their collaboration with our health department, and we have to double down on those strategies. So while indeed the health department is working on containment and mitigation efforts, it's important for people to do the things that they can do in the household, in the community. And I would encourage people to sort of look at our website, look at the state website, download the state COVID app, and make sure that they are following the guidances that are coming not only from the state but by our local health department.